It's being called a breakthrough treatment. Health editor Dr. Maria Simbra has more tonight on how doctors are working to stop a certain form of cancer before it starts by targeting a common condition.
Cheryl Begg struggled her whole life with reflux, a condition where stomach acid flows back into her swallowing tube or esophagus.
I could no longer drink tomato juice or orange juice, and I could no longer lie down at all without vomiting. I was up most of the night, and that affected my next day, how I was going to take care of my kids or, go to work if I was working.
Reflux can change the cells at the base of the esophagus, something called Barrett's. After years of watching and waiting, she got the dreaded news the cells were trending toward cancer.
They called it low-grade dysplasia. So I would look at my children thinking, oh, I have to be around and, to raise the kids.
For advanced changes, a procedure called radiofrequency ablation has been shown to help.
It's a balloon that is 360 degrees that burns the entire lining of the esophagus. Sometimes it can take up to, 3 or 4, sometimes even 5 tries.
The question has been, for mild changes, would the same procedure help? In a multi-center study, 136 patients with Barrett's esophagus got either the ablation through a scope or were watched with a scope down into the stomach over 3 years. The doctors found the risk of progression from mild to severe and even cancer was cut by up to 25%. For the majority of patients, the precancerous changes went away altogether.
Usually it resolves completely, and when you look at it with an endoscope, you couldn't tell that there was Barrett's there before that.
Such good news, the trial was stopped early.
The Data Safety Monitoring Board saw this and said, we need to stop the trial because the benefits are so clear.
I'm not on any medications at all, and I had been for quite some time. So, and I'm cured.
I'm Dr. Maria Simbra, KDKA TV News.